to introduce with our first speaker today. That's Dr. Ashwani Garg. He is a co-founder of Functional Medicine Clinic and Indian Association of Functional Medicine. Dr. Ashwani works largely with autoimmunity, gut health, and autism cases. He runs an exclusive program called Learning Disorders Program to help children with autism, ADHD, GDD, and ASD. He has worked with significant numbers of children with very good clinical outcomes. With his keen interest in innovation and well-being of society, he has started other ventures like Dr. Juice, FM Diagnostics, Wellfinity, and Autoimmunity Care. Dr. Ashwani Garg will be speaking about his topic for today is systemic enzymes for healthy aging. Over to you, sir.
Thank you, Dr. Karishma, and thank you everyone. And I hope I'll be able to share something relevant, something new.
Yeah, we can see your screen and it's loud and clear as well. Yeah, please go ahead.
Fantastic. So I think at the end of the day, we want to age healthily, which means we don't want disease and we want to keep our performance up. It's all about, keeping ourselves healthy, right? And aging gracefully, as Dr. Krishna said. Okay, so in functional medicine, there are various strategies and various ways to do it. Okay, but basics has to be taken care. Okay, there are so many tools. Okay, we are not only sticking to this and that. Depending on the ability and the interest and the pockets of the client, you can choose various strategies. So much can be done. But before you get into the most advanced kind of things, you have to make sure the base is right. Make sure the base is good to hold what are we building on the top of that. So to ensure we are doing healthy aging, we have to keep the mitochondria healthy. Okay, and mitochondria is as we age, number of mitochondria is reducing, quality of the mitochondria is reducing. That is what the disease is. That is what is aging is. And most of the chronic problems that our society suffers is primarily because mitochondria quality numbers in each cell is reducing. Okay, and most of the conditions we work with are fundamental goal is to improve the mitochondrial health. Thereby, autism gets better, autoimmune problems get better, diabetes get better, thyroid problems get better, dementias get better. Most of the chronic problems are somewhere linked to the mitochondrial health. Now, what are the basics to be done? First of all, the first priority is the circadian biology. Okay, following the light cycle. When sun comes up, we have to be in the sun. When sun goes down, we have to be in the dark. Okay, so Dr. Ruhi will be taking a much longer session on this topic, which is very, very important. Second priority is the hydration. Okay, our cells to be hydrated. As body 60%, 80% is simply water, or maybe some researchers will say more than that. But just give and take, large part of this body is water, and body has to be hydrated. And various ways to do it. Of course, the water that we drink from RO system is clean water, but it is acidic as compared to the human body, which becomes acidic to the body, which steals away the electrons, which is a big problem. So we can choose alkaline water, we can choose sun-charged water, we can choose structured water, we can choose coherent water, and more importantly, now this is again a big deal, which is called deuterium depleted water. Very, very phenomenal for the mitochondria, thereby anti-aging, thereby getting out of the disease, etc. So deuterium depleted water is a big deal. Then, of course, like Nihaji said, protection of our mitochondria from the non-native electromagnetic fields could be Wi-Fi, could be the poor lighting when you say overlighting, tube light, LED lights, etc. Okay, then of course nutrition has to be, and multiple things are available, and start with the basics and you can build on that. Okay, and detoxification is very, very important. Now, detoxification about metals could be endotoxemia. All of infections are toxifying the mitochondria, microplastics, pesticide, you name it, we have it. Okay, today the main reason that all of these basics are disrupted. Okay, and of course our microbiota, which is when we have more of the bad guys and less of the good guys, and there are strategies already shared with the fellow panelist. Okay, and cell membranes has to be healthy. Enough flow of the blood to different organ has to be there, and of course immune system should be in a position to protect us. Now, we are getting a lot of problems where immune system has become our own sort of enemy. Okay, now it is doing for a reason. It is not some that immune system has gone crazy, is doing a damage to us, not like that. Okay, it is doing for some reason. And if we fix the reason, the immune system is there to protect. So modulation of the immune system is very, very important. Now, there's so many strategies, and one of the simple strategy and very, very prominent and important strategy that I do into my practice is use of enzymes, which can play a significant role. Okay, but a lot of time we just put it under the table. We don't use enzymes in a right way, or in not enough dosing, or we just disregard. We hardly a part of the practice. So enzymes can really turn around things. Okay, now how important they are. Enzymes are the proteins which helps us to digest our food, which helps to help us function the minerals, vitamins, and hormones. If these guys has to work, enzymes has to be there. Okay, now more importantly, we have been talking about a lot of infections and dysbiosis. Now, if food is not digested, okay, you eat something, you don't digest it because of various reasons, and one of the reason is low enzymes. Your food is going to create toxicity. The food is going to create more infections. Now, whatever is going in has to be processed. Either naturally body will process to turn into something good, or body will allow certain parasites or fungal to grow in the body to process this food. Okay, now this undigested food cause fermentation, putrefaction, thereby more infections and toxicity. Okay, if we don't digest food, we can grow more infections. It's very, very simple, but again, underlooked. Okay, as we age, as we are aging, our ability to produce enough enzymes is reducing. Okay, so it is important that we either eat food in such a way that the food has intact enzymes, or we support our system with extra enzymes. Okay, now one of the misconception is when somebody has GERD, somebody has gastritis, that your stomach acid is more. There's no evidence to prove that stomach acid is more. And when we really look into it, it's a low stomach acid. As we are aging, our stomach acid is reducing. Ability of the body to make enough stomach acid is reducing. That is why as we age, our ability to digest more food, or our amount of food intake is reducing, because we are not able to digest, because our ability to produce enough enzymes is reducing. Okay, so when we are aging, if we want to maintain our health, our nutrition status, we need to ensure that our body is able to digest. For that, we have to then get into something called supplementation of the enzymes. So the various ways which I will talk about. Again, it is so important but underlooked. Okay, now simple example, if enzymes are low, you don't digest. You don't digest to allow the infections to grow. That is one. Second, you don't digest, your immune system doesn't get what it needs to function. As a consequence, more infections will grow. Now, low enzyme, poor digestion, more infection, poor immune system, more infections. And infections are a major reason behind autoimmune problems and metabolic disorders. Okay, now if enzymes are not there, undigested food, and infections in the gut can cause leaky gut, and all of these can flood into the bloodstream, thereby inflammation and immune reactions can happen. Also, when you don't have enough enzymes, you're starving your cell, and then also leads to poor autophagy. Okay, so your mitochondria is not getting what it requires. Rather, it is getting a damage from the immune system because of the high inflammation. So if we have to go into healthy aging, we have to ensure that we are digesting whatever we are eating. At the same time, our body gets what it needs to repair and regenerate. Now, this process has to happen. We are constantly repairing, regenerating. Every 24 hours, we get a new retinal lining, we get new stomach lining. Every 2 months, we get new liver. Okay, brain cells get into repair, bone cells get into repair. But if we don't have the right raw material, this becomes a big problem. So enzymes can really play some major role to help us. Now, broadly, on the application, there's so many different kind of enzymes available. On the application, there could be two main kind of uses. One, of course, you can do it with food, right? Before food, with the food, right after food, different variety of enzymes, which helps to digest your food, which is fantastic. It is phenomenal itself. Okay, But if you do enzymes on an empty stomach, that is the systemic use of enzymes, okay, then it can do a lot more things for you. When you use enzymes on empty stomach, which is very, very critical. If you use enzymes with food, along with food, right before and after, it gets consumed in digestion, which is itself good. You need to be digesting your food. But when you take enzymes on an empty stomach, phenomenal. Okay. For example, you have to digest carbs, you want to take some amylase, sucrase, maltase, lactase, and then break it into the glucose, etc. If you're taking proteins, then you need pepsin, you need betaine HCl, you need trypsin, so that you digest your protein part. If you don't digest it, start putrefying, and lot of toxic waste will go into the system. Okay, so again, for fats you need lipase and bile and etc. Okay, so food digestion is very, very important for our healthy aging, for our anti-aging, so to speak. Okay, so this is important. So the process of digestion consists of mechanical and enzymatic breakdown of the food. Okay, mechanical, of course, the body will do its function, but if enzymes are low, this process is halted and it becomes a problem. And if enzymes are not there, food is not digested, that becomes a major reason behind the leaky gut also. Now, leaky gut, as we know, is a major reason behind a lot of autoimmune problems, lot of brain problems. Now, we work with a lot of autistic children. 90% of them have a poor digestive health. 90% of them. Now, it's not a coincidence that because of the autism they have a poor gut health. Rather, I would say that because of the poor gut health they have autism. Of course, there are other nuances to the problem. There is radiation, etc., etc. So much other issues are there, but this is a huge issue. And many of them, they're bloated, they're constipated, they have diarrhea after every meal. The moment we start a little bit of enzymes, a lot of their trouble, their bloating gets better, less pain in the body, and less tantrums in the child. And child start getting better. Okay. And we start enzyme, they start breaking down their food, body start getting what it needs, and body start going into repair also. So this is very, very this thing. So you can take protease, amylase, cellular, betaine, HCl with food right before food or right after meal, so that the enzymes are engaged in digesting the food. Okay, so that it can break down the food and body can get the micro and micronutrients to the system, so that body can go into repair and thereby healthy aging. Now, aging also, we are not able to repair ourselves. That's a big, big issue. Okay, when we test anybody with autoimmunity, anybody with autism, anybody with gut issues, their proteins are low. A lot of people are on carnivore diet, but their proteins are low. Their amino acid profile is very, very poor. Okay, so there are blood markers. You can test the nutrients for the protein. There are organic acid tests. You can test them for their profiles of amino acids. A lot of vegan guys are low on proteins. A lot of vegetarians are low. Carnivore guys also are low on proteins. We have worked so many with these guys. Okay. Now, reason is not that they're not eating the right kind. They're eating the right kind. Maybe they're not able to digest that. Now, that is important. What you eat is important. What you digest is even more important. And this is why if you're not, after eating, you feel bloated, you feel constipated, you feel very heavy. This means whatever you're eating is not suiting, it's not working, it is not becoming part of you. This food has to become the part of the body and it has to be digested. This is where enzymes has to be very, very important. Okay. So again, India, we are able to either source from outside or we are trying to make it in India. Good quality things are available for the practitioners or for the, all the people who want to do it for themselves. And enzymes are very, very safe. There's hardly any problem if you have to take the enzymes with food. Very, very safe. Okay. So we have a very, very potent something called Digest-All. Now, a lot of people have taken out their gallbladders, which is even a bigger problem. Okay. A lot of time we speak to the people who come to us. They say, I had some pain. I went to the doctor. They done some ultrasound. They found some stones in the gallbladder, and they say this is the problem. Let us take this gallbladder guy out. Now, the moment the gallbladder is out, problem has increased in most cases. problem has increased in most cases because bile concentration is not happening. Digestion becomes even more poor. Problem even becomes bigger. Okay. So in such cases, at least with the meal, you can take a enzyme with a broad spectrum enzymes into it, plus some animal bile or bile acids, maybe from vegetarian sources, if at all available to you. Okay. This digest care give you ox bile with the variety of enzymes to digest most kind of your food, plus fats also. This relieve you from digestive this thing. Then something called super digestive enzyme. Then of course betaine HCl, which is GERD care. So again, depending on your need, depending on kind of food that you're eating, kind of symptoms you have, you can work with a practitioner, choose right kind of things. But if you have digestive disorders, IBS, IBD, any problem, if you start including digestive enzymes with your meals, it will certainly give you a lot of benefits. Okay, long-term benefits. Short-term, certainly after meal, it becomes better for sure. But long-term benefits also, because if you don't digest your food, the long-term consequences are even bigger. Now, coming to even a better topic, which is systemic uses of enzyme. When you use an enzyme on an empty stomach, it even becomes more powerful, mostly proteolytic. Okay, it helps your lungs, it helps your digestion, it helps your blood vessels, it helps your joints, it helps your eye health, it helps your hair health, everywhere. Okay, systemic enzymes are so beautiful and powerful. Okay, so they operate throughout the body in every system and organ. Once you take an empty stomach from the digestive system, they travel to the site where they have to work. Okay, now they can help you modulate your immune system. Okay, they can make your immune system much more powerful. They can also act as an anti-inflammatory. Now, anytime we have clients where they have a lot of joint pains and overall malaise and all that, I hardly use anti-inflammatories. Most of the time we use enzymes. Now, these enzymes could be nattokinase, could be ceratopeptidase, or could be any broad spectrum, but used empty stomach. Now, if we have anybody with a lot of mucus and excess breathing difficulty, then also these enzymes can play a big role. They help to reduce thick mucus. They can act as a mucolytic. Okay, they can optimize natural recovery processes of the muscles and joints. Now, when inflammation is less, nutrition is up with the use of the enzyme, as a consequence, body goes into repair. Joints will also go to repair. Okay. So it can reduce the physical discomfort when working as an anti-inflammatory. It can also improve your blood circulation. Okay. It works as a fibrinolytic. It can, all the clots and all that can be dissolved. It can dissolve your gallbladder stones also, because most of the gallbladder stones are cholesterol stones. If you use the right enzymes on empty stomach, it will help you slowly dissolve them. Okay. And of course, analgesic and antioxidant properties. So powerful. This is a very simple thing, but now if we little elaborate, it can has a antimicrobial effect. For example, E. coli receptors are broken down by the enzyme, so it becomes less reactive to the body. It is E. coli infection becomes less potent as an infection when we use enzymes to clean it. Now, after COVID, or after COVID vaccines, we are seeing, and you as are aware, a lot of people are getting into a lot of this cardiovascular problems. Now, we work with these cases, their inflammation is off the roof. Okay, they have this cardiovascular inflammation in the system going on, especially heart muscles. Okay, and there's a lot of data available. They say a lot of spike proteins are high, which is constantly triggering inflammation. Okay. Now, there's hardly any way. Now, the vaccines are, of course, as you're aware, the recent ones from the Pfizer's and all that, they are actually, in a way, genetically modifying us in a way. We keep producing these spike proteins. For how long we are producing, nobody knows. Even these companies don't know. So we are constantly producing these spikes, which is triggering inflammation, which maybe whether during the pandemics helped or not, that's a question to be asked. But at least consequences people are facing now. Now, these enzymes, especially bromelain or other protein-like enzymes, can break these peptides of the spike, thereby less inflammation, less reactions, thereby at least you keep yourself protected. Okay, they can detox the blood. Okay, detox the internal system. Now, blood is always trying to maintain the best of the chemistry. Body might have more deposits of the toxins, but blood will be the best chemistry. Nutrition will be always more in the blood, and toxin will be less. Now, when we test people with a lot of problems, even in the blood, lot of heavy metals, lot of infection, inflammation is going on even in the blood. Okay, so enzymes can really, when used on empty stomach, can clean out this foreign, eliminating impurities, foreign proteins, immune complexes, and of course the microorganisms. Okay, a lot of the waste that is there can be cleaned out. And of course, it improves the ability of the immune system to fight the infections. Okay, it can help the immune system to kill bacteria, viruses, mold, fungi, etc., etc. Okay, so it makes your immune system much better. It reduces your inflammation. It works as an antioxidant also. Okay, to remove the free radicals. It can work as an anticoagulant also. Okay, clot formation is reduced. Now, of course, depending on the need, a lot of people go into various anticoagulant therapies, but enzymes are even a safer option. Generally, when you take a pharmaceutical, there's some risk associated with it. But enzymes done empty stomach for systemic purposes, no side effects whatsoever. In most cases, very, very safe, extremely safe. Okay, it can also help to the atherosclerosis. If arteries are clogged, these enzymes can also help to declog these arteries, improve the blood flow to various parts of the body. Okay, that is very, very this thing. Now, lot of the work that we do is related to chronic infections. A lot of people turn into this antibiotic resistance cases. The reason behind this chronic infections and resistance of certain herbs and antimicrobials is the biofilms made by these infections. Now, slowly, gradually, these enzymes can also help us dilute, dissolve these biofilms so that the drug or the herb or whatever therapy we're trying to do can go and fight these infections straight away. Okay. Otherwise, just like you and me as humans want to survive, these infections and parasites also want to survive. So they build their protective lining, and these biofilms are that. So when we use enzymes on empty stomach, they help to clean out these biofilms. As a consequence, our whatever work we are doing, okay, be it infection control, be it cleanup of the gut, whatever we're trying to do, enzymes will play a role into it. Okay. Now, very, very important thing, which is autophagy for repair and regeneration. The old cell has to go, new cell has to come. That is how this body is. We are constantly remaking ourselves. But if we have unwanted things in the body, if we have undigested things in the body, or if we are constantly engaged in digestion, our energies are engaged in constantly in digestion. Digestion is a very, very energy intense process. It consumes a lot of energy. Okay. If we are constantly busy with that, there's hardly time for the body to go into repair and autophagy. So it is important we are able to digest our food, and it is important that we are able to clean our system so that body is able to go into autophagy. Okay, that is self-repair. Old cells will go, new cells will come. And this process has to keep happening. And till we die, this process, maybe intensity of the process has reduced, but it keep happening. Just like you cut your finger, you will grow new tissue and it will heal. So healing keep happening. It just, we have to create the best of the conditions. Okay, there's no only one solution to these issues. You have to do the baseline work. On the top of that, again, you have various things. Enzyme is one thing, HBOT is one thing, ozone is one thing, peptide is one thing. but you have to set the baseline. Then you make sure that you do the right kind of things, and you will have phenomenal outcomes for your this thing. Another thing that happens is, as we are aging, our extracellular matrix becomes more stiffened. As a consequence, nutrient supply to the cell becomes poor, and detoxification of the cell becomes very, very poor. Now, that is also very important that we keep this extracellular matrix more flexible, more permeable, so that nutrition can go into the cell and toxins can go out of it. And this is where also enzymes taken on empty stomach can really play a very, very important this thing. Okay. Now, various kinds of enzymes are available: ceratopeptidase, nattokinase, plant protease such as bromelain, pepin, and proteases from the, let's say, pig stomach, pepsin, or pancreas, trypsin, chymotrypsin. So various kind of things are available. As long as we want to, do it, options are there. Okay, if we have developed certain formulations, now all of these, whatever we have done, just to ensure that we are able to support our patients. So from our clinical practice, we have learned these lessons, and we have developed these things. But again, either you get it in India or outside India, there's enough options available. As long as you open-minded, and as a practitioner, you want to, make sure that you want to try a lot of things, there are enough options available. So these are some of the options we have developed, very, very potent. Now, enzymes, another thing about enzymes is, what do you say? There's so much in the market, but potency might be very, very different. Enzyme amount might be same. It is 50 mg or 100 mg, but their potency can be different. So you have to choose the right enzyme, the right potency. So this is important, that choosing the right kind of products. Okay, so that's all that I had to share. But enzymes really has helped us into our practice. We do it for children, we do it for adults, we do it for elderly, wherever, and it is really helping us into our practice. So thank you. Hope it was something useful.
Yeah, thank you so much, sir. As we all know that, the starting part of the gut treatment is the enzyme, fixing the enzymes first. There are multiple, the entire chat box is flooded with questions and questions. I'll just ask the two of them, and then if you have time, you can please stay back and answer those questions. There's one question that says that, how long can we take enzymes? Will the body, and this is a very common question, will the body get dependent on enzymes when taken orally and stop producing its natural ones?
No, body will not produce its own production.
Yes, it will not stop its own production. It will go on, and it is just aiding on the same. I guess you've got the answer. There's one more question. If there has been a surgery of gallbladder removal, that is cholecystectomy, can you put on nutritional ketosis plus the enzymes?
If you see, again, ketosis means a diet should be 80% fat. Right? You have to use a lot of fat to induce ketosis. So yes, then you have to use enough enzymes. If your gallbladder is not doing okay, then you support with more lipase and more bile and other enzymes, so that you can do it. Technically, there's no problem. You ramp up your enzyme intake.
Okay, thank you so much, sir. One more question. I'll take two more. Which of the enzyme is the best biofilm disruptor, if you had to choose one?
Right. Again, there's no one answer.
One answer to the same. Yeah.
I have developed something called this Candida Care. Now, Candida Care is proteolytic enzyme with cellulase. Now, this proteolytic enzyme, two capsules will give you approximately 360,000 HUT, which is very, very high potency. Now, that is good. And of course, die-off is another thing that can happen. So, okay, when you clean out these infections, die-off can happen, and you change your frequency and the dosing so that you are safe.
Yeah.
It's not a problem, but you need to know that it's, sometimes people come to us, no, your product is not working. It's just a die-off, which means it is working.
Which means it's working, yes. Yes. There are some more questions in the chat box. One is on fungal diastasis as well. Please answer that question. Just stay for some moment and we can move to the next session, sir. Thank you so much for joining us and enlightening us with the enzymes and their effects on the body. Thank you.